At ESO, our lab isn't just another science project. It's a genuine launchpad for the next generation of an emergency response ecosystem. What does innovation look like from the inside? Here's what goes on behind the scenes of ESO's labs. Let's meet the team shaping the future of community health and safety outcomes at ESO. Our mission is to push boundaries of emergency response and healthcare technology, to explore, test, and build solutions that shape the future of community health and safety. We're thinking about documentation automation, real-time decision support, the use of AI technologies, especially machine learning and generative AI, to help first responders and leadership achieve their missions.
Again, these features, we want them to be additive, right? We want them to be something that's going to assist them, but not replace them, and certainly not take away the autonomy of the fact of how important each of their roles continue to be.
Here, ideas don't just stay on the whiteboard. Our labs teams are hard at work prototyping new solutions with frontier technology. Take auto-generated narrative, for example. This is a feature within our EHR product that allows providers to generate a first-pass draft of the narrative, which is typically the last mile of patient care record documentation. When we first conceived this idea, we were able to rapidly prototype it in just a few weeks. In partnership with internal stakeholders and clinical subject matter experts, as well as our customers, we iterated on this idea over a period of several months and eventually deployed it live into production. It's safe to say that the results spoke for themselves. In just 3 months, we've seen over 500,000 narratives generated by this new technology, and by our estimates, that translates into over 150,000 hours of time returned back to EMS crews from returning to service versus spending time on documentation. The best AI features compound in value over time. As a fast follow to AGN, we're now looking at voice, so you can narrate your documentation and have ESO do the heavy lifting of analyzing what you said and convert it into discrete chart elements.
Medic 2 was dispatched emergent lights and sirens to the rescue mission of Trenton for a complaint of a fall. On arrival, a 43-year-old male was found sitting on a sidewalk with a crowd around them.
This will be a powerful time saver for clinicians in the field. Voice is a powerful way to expedite documentation, and we plan on rolling this out throughout our suite of products. But as a bit of a teaser to where we really want to take this, we see the vision of the future being hands-free. No keyboard, no mouse, just ambient listening in combination with video and device data to synthesize your documentation for you.
Keeping the human in the loop for being able to review critical criteria. You don't want to remove them. We want this to be an assistive feature that is a partner in the process of their daily job rather than a replacement.
ESO Labs functions much like a startup within a larger organization. And this allows us to move briskly, rapidly prototyping new ideas, addressing challenges and pain points that we've heard from our customers with next-generation technology solutions. Our philosophy is simple: experiment boldly, learn fast, and keep the human at the center. This lab isn't just about technology, it's about creating the future responsibly.